Hello, everyone. Welcome to this webinar, Demystifying AI for Health. My name is Carol Sanchez. I am the head of the nonprofits relations team at Tech to the Rescue. And during this webinar, we have three amazing guests, Maria, Bruno, and James. They are part of our community as well and our partners as well. So I'm happy to have them here. I'm sure that they will bring amazing insights to this conversation, and we can start by them introducing themselves. So maybe, James, you are the first in my screen, so you can start.
Thank you, Carol, and thank you everyone for joining this session. Really looking forward to it. My name is James. I'm Head of Digital Learning at Save the Children Humanitarian Leadership Academy, and my team are responsible for creating humanitarian training resources for those going into disaster-affected countries. And one of our largest programs is public health and healthcare. So I'm really looking forward to sort of talking to you about some of the ways we're using AI in that area. And I'm also dialing in here from UNESCO Digital Learning Week in Paris. So this isn't my room, this is a hotel room, just dialing in. So I'm also really looking forward to sharing some of the discussions on policy and regulation about AI that's also come up this week. So really, really looking forward to the discussion.
Thank you so much. Now, Bruno, you're under James, so I think it's your turn.
Thanks very much, Carol, and thank you very much for having me in this space. My name is Bruno. I'm the Senior Legal Program Manager at Trust Law for the Europe, Middle East, and North Africa region. So for those of you who are not particularly familiar with Trust Law, we are the world's largest pro bono clearinghouse, which means that we work with social enterprises and NGOs to make sure to the greatest degree possible that they have access to free legal advice. Quite often that advice that we connect is on operational matters, and increasingly we are helping more and more NGOs with operational matters relating to artificial intelligence and data protection. So I'm really delighted to be speaking to everyone based on those experiences.
Thank you so much, Bruno. And just for everyone to know, here in Tech to the Rescue, we all love Trust Law. So I just shout out to them. And now, last but not least, absolutely, Maria.
Hi, everyone. I'm Maria. I'm the Chief Marketing Officer at Omdana, and we are the largest AI for Impact organization in the world. What that really means is we work a lot with NGOs, nonprofits, and larger companies to implement AI solutions. We have over 30,000 engineers worldwide, which really allows us to work across different industries. But one that we have really been diving deep into lately is healthcare. My role is really to understand all of those applications and help spread the word. So I'm really excited that all of you are here to talk to all of you and be speaking with the rest of the panelists.
Thank you so much to three of you. I see in the chat that people is commenting where they're joining from, so keep that. I love to see all of the places. I see that we have people from Lebanon, Ethiopia, Ghana. I want to check if there's someone from Colombia as well, just being a little bit patriotic here. And before we start with the questions, I want to let the organization joining us the topics that we will have today. We will be talking about the current state of AI in healthcare, also something super important to all of us, that is the ethical considerations and the data privacy surrounding AI implementations, and also AI implementations in resource limited settings, understanding that it is expensive and also the access can be sometimes rocky. And lastly, we want to talk about these pro bono implementations and how tech companies can work better with nonprofits working on healthcare or just health in general. So I want to start on a good note and kind of having an inspiration to all of the nonprofits joining us. So I want to ask you, we can start by Maria, that was the last one presenting herself. And I would want to know what is the best use that you've seen from AI in healthcare settings. Just this example that you will say, wow, this was groundbreaking.
Mm-hmm. One of the projects at Omdana that has really been something that we're proud of, and I've said, wow, myself, is we are currently helping develop a new drug for malaria, which is very important. And it's a different type of application using past data, how we can help really develop something new, and seeing AI be implemented from a research point of view rather than just from what you see in typical organizations and how a lot of healthcare companies are just ramping up. We're starting to see AI really drive the future. And I think that's something to really be excited about. And I know that as a part of Omdana, I'm really excited to be a part of it as well.
Great. James, do you have also something in mind that you can talk us about?
Gosh, that's a really good one, actually. I've got a couple. I mean, the one really inspiring one that always jumps to mind is the AlphaFold project from Google DeepMind. This is one of the really big ones about how you can use AI in order to calculate protein folding, and that the work there is in terms of human years, the amount of work that's gone in such a short period of time is amazing, and that's going to unlock so much in the future. Bringing it slightly more down to sort of the work I do, is that there is a huge amount of fantastic work going on in training for healthcare resources. That's for practitioners, but also for just the general public in terms of being better understood. And one of the real projects I've seen recently, which I'm really impressed with, is WASH AI. So WASH stands for water, sanitation, health and hygiene, and sanitation and hygiene. Sorry, and what they're doing there is taking a lot of very technical manuals. There's a huge number of very technical manuals, using AI to distill that into much more easily understood material. So then practitioners could use that in the field, and that individuals can use that as well. So that's another really great example I've seen recently.
Thank you both. As you know, we have this accelerator, AI for Changemakers, and the first cohort was about disaster response. We received 25 projects from the 10 organizations joining this cohort, and some of the projects that they presented were about prevention of disaster, or just like getting ahead of the disaster, right? So I was wondering if this can also be implemented in health, just preventing or also forecasting the effects of a disease, or if you see any other trends that are hot at the moment and some organizations can use for health. And also, I believe it's important for some organizations, mental health. So we can start. James, maybe, again, you are the first one in mind.
There you go. Sorry, I'm unmuted. Sorry, I wasn't expected to come first. Fantastic. I mean, starting with mental health, I mean, this is a big one that my team work with. We work across Europe with the mental health, psychosocial support conglomerate, and that's a huge aspect of the work we do, particularly in conflict-affected countries, disaster-affected countries. It's a massive work we do at the moment. It's kind of one of the main things. And in terms of AI usage for us, it's a lot of the resources that we need to produce to help with those. It's very contextualized. It requires a lot of knowledge of the local situation, and actually developing high quality learning resources and support resources, it can be very expensive if it's contextualized. But what AI is able us to do is very, very quickly co-design resources. That's either images, animations, videos, audio, all these things. So that's one of sort of the big things we're doing very specifically in conflict zones with health. I've got lots of other examples, but I'll wait for a little bit later to share those. So I'll hand over to them.
Okay, Bruno, also, if you have any ideas of AI, just like feel free to tell us.
I feel bad because I don't have examples quite as sexy as the other ones that are described. So at Trustle, we haven't seen that many products come through that are specific to the healthcare context, and I suppose that's why I'm here now, for purely selfish reasons, because we would like to see more. As you know, coming from a legal background, I think kind of one of the things that I really struggle with is trying to explain kind of complex issues in kind of human and accessible language. And one of the few examples of the AI being used by NGOs in the healthcare context is to use it in order to kind of provide that information in a simple and accessible format. So one project that I've come across is, for example, a healthcare charity trying to use AI a bit more effectively in terms of providing that information through, for example, a chatbot or other types of services that they have available. Obviously, they have lots of concerns about data privacy and liability as well. So that was a really interesting project to find out a bit more about. But, you know, I always get surprised when I speak to NGOs about different questions around AI, the diversity of different projects and initiatives that they've got going on. And I also get really surprised about the number of different legal aspects and questions that come through as a result of their efforts to use AI.
Thank you so much, Bruno. That was actually super interesting. So, Maria, I guess you also have like a lot of ideas on trends. What your organization should be thinking when thinking about projects for AI?
Absolutely. Well, what Bruno and James both mentioned, very important, all things we're seeing from diagnostics in, disease to mental health, and the way that we're implementing AI changes. What I think that a lot of companies need to start considering is mapping out the healthcare journey from patient intake to how they're being seen by different healthcare professionals, what their outcome can be, all the way to bill paying. Dana did a very interesting project where we were using AI to predict for terminal cancer patients the amount that they were looking at paying up until their terminal year. Healthcare has so many different types of applications. So being able to map what you are trying to solve will then give you insights into how you can apply AI rather than doing it the other way around. Well, there's so many different amazing projects and applications that we are seeing, it's very easy to silo yourself into one way of thinking about how to apply it to your own company. And I really think it's a different way of thinking and an empowering way for your company to map out your own process and your own goal and what you want your impact to be, and then start having the conversation about AI. And I'm very confident that you'll see amazing results from thinking about AI from a different point of view.
Wow, thank you, Maria, so much. I want to go back to James just out of curiosity, because I understand this mapping. We're talking now about health, but also coming from a humanitarian background. And I was wondering, James, if you think this mapping can be used in other humanitarian settings. You already talk about WASH, we already talk about disaster response, but do you believe it could be useful in other kind of sectors in the humanitarian section?
Oh, absolutely, definitely, yes. And Maria, it's really got the sort of clear trend for us. Human-centered approach to AI is kind of one of the things that's come out this week in UNESCO, how important it is to be human-centered, and that starts with understanding what is it that's the need, what it is the final interaction is going to be, and then work back to the technology, which might be AI, it might be other things. I think it's super important. And I think the other thing to bear in mind with the process is co-design being incredibly important with AI. I mean, there are some really fantastic specialized AI applications, and we've mentioned a few, but a lot of the use of AI in the future is actually just going to be the practitioners themselves in whatever setting they are. They're going to use it in their day-to-day process. So the more they can understand what is possible, how they can co-design with themselves is incredibly important. And I think it's applicable across all the different sectors, all the different work we do.
This is amazing. So the organizations joining the webinar already have some ideas if they want to apply to either the accelerator or to our regular pipeline. Bruno, you mentioned before something that is super important to the organizations we've been talking to. They always mention that one of the biggest risks they see in the implementation of AI is data protection. Do you think, or do you have any ideas on how this risk can be mitigated?
So yeah, data protection is can seem like a very scary thing. When you're trying to think about using AI systems or building AI systems, and in particular in the absence of kind of implementation of AI-specific regulation, data privacy and data protection regulation is really the thing to be thinking about when it comes to regulation, generally speaking. I think we'll go into that a little bit. I need to qualify that a little bit, but anyway. The kind of best practice that we see from NGOs that are quite conscious of those risks, and they do this also because under certain data protection frameworks, it's pretty much a legal requirement, is that they do some sort of an impact assessment. So an impact assessment is an exercise in which you carry out some sort of an audit where you try to analyze the kind of data that you'll be processing, where this data will be coming from, how you'll be processing that data, and quite importantly, also kind of what kind of risks and impact that your system is going to have, particularly on individuals. And then you would also then try to outline the kinds of strategies and measures that you would seek to implement in order to mitigate those sorts of risks. And the exercise is often going to be designed in order to make sure that you don't collect or process more data than is necessary, and you have special protections, adequate protections, in order to make sure that the data that you use is accurate, that it's safeguarded, and that it doesn't discriminate, or the usual kind of risks associated with the use of data. And the reason why these kinds of exercises are particularly important is that, particularly under certain types of data protection legal frameworks, like the GDPR, the more kind of novel the use of a system is, especially in the case, and this often applies to systems that employ artificial intelligence, and the more sensitive the data is, and this is quite often going to be the case in the healthcare setting, the more likely it is that you are under a legal obligation to carry out these kinds of impact assessments. The best case examples of NGOs taking the right approach, I think, is for them to have a go in the first instance at trying to map what kind of data they use and they intend to use, and what kind of mitigation strategies they have. And of course, then to seek legal advice or independent advice to make sure that they are adopting the right sort of strategy and that they have identified all the risks. But I would also then like to specify that that's not, although data protection is often the thing that lots of people seem to think about when it comes to legal compliance, there are other kind of legal compliance issues to think about, not just in relation to regulation, but also your rights vis-a-vis third parties as well.
Thank you so much, Bruno. I don't know if you want James, Maria to comment on that before I ask you some follow-up questions on it. Okay, so I do have a question for each one of you. I can start with Maria. And while Bruno was talking, I was thinking, what can tech companies offer to these nonprofits for them to be safer and to feel that they are following this approach that Bruno described?
Mm-hmm.
In Europe, what is it?
Absolutely. So I think that for companies to be confident in the projects they're doing is to know what the regulations are. So working with a specific partner to develop these solutions and implement, it's important that you can trust them because of what they have done in the past. And because AI is always innovating, it is a relatively new idea. It's important that you're also working with a curious company. How is this company constantly improving their own education, working with people like Bruno to have these conversations, because it could cause a project to completely have to pivot or even stop to make sure that your innovation isn't compromising other needs in the healthcare industry. As Bruno mentioned, it's more than data privacy. There are a lot of different ways that different, not only regulations can come up, but different ethical questions and issues that we haven't uncovered yet while we're still building. So working with a company that is trustworthy, but also always growing and educating themselves is really the key to success here, and also the key for any future type of innovation in AI.
Great. Thank you so much, Maria, for that. James, from the other side, you're representing a nonprofit. What do you think it will make you feel safer to work on these topics? But I was also wondering if you think it's easy to smaller organizations to have all of these safety measures. Like sometimes we have realized that big organizations like Save the Children, for example, they do have data privacy policies in place, they have GDPR, all of this, but maybe sometimes smaller NGOs, they don't. So how to mitigate that from the side of the nonprofit, and what would you require from a tech company to feel safe?
No, great question. I think I probably should start by saying is that being within an INGO, yes, we do have sort of a substantial infrastructure in place ourselves, and we've got various policies in place, but it does mean we cannot be as nimble, as innovative as smaller nonprofits, and I think that's really, really positive and really important. We work quite often with other smaller non-profit charities, particularly local charities working in response countries, because they're able to both have local context and also have the ability to be a little bit more nimble with that. I think I'll think about this sort of in two approaches. Actually, I'll sort of think about it in terms of like a local charity versus what it's for Save the Children. I think one thing to bear in mind is data sovereignty as well in all this, because there is sort of a growing discussion at the moment with AI that most of the tech companies, and that's particularly the bigger tech companies that come from the global north, a lot of the content that's being used for those AIs are based on more of a global north culture, predominantly English. And I do think it is something that all charities should have a little bit to think about: is who owns my data, where is it stored, am I working with a partner who understands the importance of the data to us as a charity in the future, and it isn't just using it as data that will be owned by them in the future. And I think that's something that's really important. And I think that's why I think sometimes actually the smaller tech companies often are the easier to work with, particularly if you're doing something innovative, because the larger companies will always be looking to centralize that data sovereignty. And it's certainly something that we bear in mind at Save the Children. Although as a large organisation at the scale we run at, we do tend to work with the larger ones in a sort of different kind of partnership. So hopefully I'll answer. If there's a follow-up question, Carol, to sort of help clarify that, but I try to sort of give two aspects of that question.
Yeah, actually, it helps me to go to my next question already. And it's about also the ethics of it, right? Like, we understand that sometimes this kind of collaboration can be seen as unequal, because there's a nonprofit receiving pro bono something for free, and there's a tech company putting the resources, and most likely they're coming from the global north, while the NGO or the nonprofit is coming from the so-called third world, right? So I want to also to ask you, how can we balance the need for innovation in AI and these ethical considerations? It can be like getting away from the top-down approach, or just keeping in mind the different needs. And I think we can start with Bruno, because you've been also fostering kind of this pro bono collaboration with also different kind of stakeholders.
This is actually really tricky, and I don't think I have a straightforward answer. And these kinds of power dynamics is something that's really difficult to resolve. And certainly, it's what we're trying to do at Trust Law, is to kind of balance out those inequalities. And it's the very kind of strange thing about pro bono is that kind of the power dynamics between client and lawyer is flipped. And kind of, you know, it kind of, the service provider is somehow at the more privileged position, and the classic way of looking at it is that the NGO is in the receiving end. But I kind of see pro bono as quite different in reality. So I think there is something genuine that the pro bono legal services providers get as a result of providing pro bono legal services. And this applies especially in the context of artificial intelligence. And it's because lots of law firms are very keen to demonstrate their experience in this particular area and to improve their level of expertise in these sorts of settings. So in effect, what NGOs are doing by essentially providing pro bono matters to these law firms is providing them the opportunity to enhance their abilities and skills in this particular area. And you don't need to necessarily think about it in a way that kind of you're the giver. They're the givers and you're the takers. There is something that the NGOs are contributing in this particular area. And of course, the civic space is a place of great innovation and great new ideas that the for-profit sector can really learn from. So yeah, I mean, so our general message to the NGOs that we work with is that, you know, don't be scared to use services like Trust Law to find and source the legal support that you need. You know, I would really encourage nonprofits to use us as a maximalist service. So if you have a bunch of different project ideas or legal request needs, legal assistance needs that are related to artificial intelligence in particular, not exclusively, but, you know, that's an example. You know, don't be kind of precious about, you know, contacting us or another pro bono clearinghouse to get that support, because you will find actually that support is actually very much available, and you might even find that there's actually competition to bid for those types of projects.
Great. This is an amazing invitation to the nonprofits joining us and to all of the nonprofits in general being part of Tech to the Rescue. But I will want James and Maria to answer the same question. So, keeping in mind, I will just gonna repeat for the sake of everyone. Um, how do we balance the need for innovation with the ethical concerns regarding these two different stakeholders? But also, if you want to talk about this a little bit, data privacy for patients, for example, and we can start with Maria.
Great. So Umdana balances by being a community first organization. So when we think about ethics and we think about, subconscious bias and how we're working with NGOs, nonprofits, smaller companies, larger companies on different continents. What Umdana does is we focus on making sure that our community is large. As I mentioned at the beginning of this call, we have over 30,000 engineers. And what that really helps us to do is not only staff the projects correctly by trying to omit those biases, but we also are able to upskill our engineers in the sense of what projects are they working on where we can deploy them for NGOs who have the smaller budget, no budget, however we want to work on the project while still gaining value from it. So when we're looking at these ethical concerns, when we're looking at how we partner, it's really about having a company that is as agile as you need. And I echo what Bruno says. I mean, not being afraid to reach out, ask these questions. Companies, like Umdana, like Trust Law, working with companies like yours, the NGOs, the nonprofits, that is a large part of how altogether we're moving AI forward. We're learning about different ethical considerations, and ultimately we're better for it.
Great. Thank you so much, Maria. James?
Yeah, perhaps if I take a bit more of a global perspective about it, different countries, different continents are taking a different sort of approach, but I think everyone has a sort of same sort of motivation at heart. In the US, they very much are embracing the innovation because a lot of the technology innovations are coming from the US, but they're also embracing the concept of AI safety. So there's heavily investment in ways it can be made more safe, how AI applications are going to be used in more safe ways, and people being aware of that. And I would say it's been in the interests of all of the major companies working in AI to support that, and there's a huge amount of all of them are working in this field and really trying to really support that initiative. In the European Union, they're taking a much more of a regulation of first approach, but they are doing it in a very much a risk management perspective. And I think Bruno's kind of explained that. The European Union have recently launched the Artificial Intelligence Act, which is very much about getting regulations out there before the applications become too common. And one of the big things about the Act is about understanding that different applications of AI will have different risks, right from no risk. There are examples of AI which don't really have data privacy risk. They're just the automations that just are going on without any of our own data happening. There are the AI that requires more transparency, that the understanding that, that you're creating images, for example, that are AI generated. There's an expectation you need to be transparent about it, or they may have used content from sources. They need to be transparent about the sources. Then there are the high risk, which are not something to not do, but things you just have a higher requirement to be aware of the risks of that. And healthcare is one that has been signposted as a very, very big area because of the potential risks of healthcare data being used in an unethical way, and also in life or death situations. If AI is put in those kind of situations, there is a high risk. It's not that they won't be accepted, but there's just higher expectations. And there is a category of AI should never be used, but that very much is a sort of a limited category. So just two kind of different perspectives, and it really is about balance. If I'd say anything in terms of what we should be doing is, we should be trying to lead these conversations. Let's not be led by the governments. Let's not be led by the tech companies. Let's be part of the conversation with them, because they really are open to these discussions. And because I think that's where we're going to get to the best outcomes in the future if we're all involved at the very beginning with these discussions.
Well, yes, James. Then a follow-up question to this, because I believe this is important as well for us in Tech to the Rescue, but also for the organizations that are joining. Do you know about any resources or places or a way for these organizations to start to be part of the conversation? And maybe, Maria, you can also have some ideas of AI hubs, different spaces where they can go and be part of the conversation as well. James, and then Maria.
Well, I mean, I better do a plug since I'm here at the moment. UNESCO are running Digital Learning Week, and I know a lot of digital learning is kind of a broad description of all the different fields connected to training, but also in terms of like learning about AI and things like that. There's a lot of actors who are coming along to these sessions to network, to talk to non-profits, tech companies. So the more you can go to these kind of hubs in person, that'd be my little plug. I'll let Maria sort of talk about maybe some sort of other examples.
Yes, there are so many. To be specific, we need a whole other webinar. But I think coming to this webinar is a great start for everyone here. Aside from that, as James said, I mean, getting in person, networking, really going back to my previous point about being curious. There are so many different opportunities to learn because everyone is learning together right now. So making sure you're interacting with, not only Dana, but Trust Law, Save the Children, Tech to the Rescue. Companies are always innovating, evolving. So having that curiosity, not only about your industry, but others, we're seeing a lot of crossover for different types of application and innovation. The opportunities are truly endless. And I think it can be intimidating at times to know where you're spending your time. Is it worth it? But the key is to just start attending, start listening, start calling in. And ultimately, I mean, I'm happy also reach out to me. We can have a conversation as well. Being connected in the industry is also very helpful to answer questions and understand more.
Great. Bruno, I saw you nodding, so I believe maybe you have some other tips.
I wasn't going to say that I had any tips, but I was going to fully agree that there are just so many at the moment. And sometimes that can be quite overwhelming and quite challenging. Kind of like, every time I go to an event of this kind, a networking event, there's another one that somebody talks about and that sort of stuff. And I think kind of joining those kinds of spaces can be a little bit more daunting and challenging than, we might think. I think we all started at different places, right? So when I first started to think about AI in my previous position, I really had no idea about anything. I was really scared to even ask the question, like, what is an algorithm? But that's actually a totally valid question to be asking. I would say to those people who are kind of new to these spaces, don't be scared to ask what might seem like a fairly dumb question. There's no such thing as a dumb question in this space. We all had to start somewhere, and if we're not supported along that journey, then we will be ill-informed, and we won't be able to explore whatever opportunities are available to us.
Great. Thank you so much. I fully agree with this. I think that even myself, I am not precisely tech savvy, but I come from the humanitarian sector, as I said. And when I came first to Tech to the Rescue, I was scared to ask these questions because I didn't know myself. And I was working already in a tech savvy environment. So I completely agree. And that's an invitation to all of the nonprofits joining us. Like, don't be scared. There are now so many resources. We have now Maria offering herself, Bruno as well, to legal questions, AI related ones. So don't hesitate to raise the hand, ask the questions. Also, it's a great opportunity to get in touch with Tech to the Rescue. We're going to have scoping sessions as well for you, so you can just ask these kind of questions. But Maria, I want to go back to something that you discussed before, and it was the bias of these algorithms sometimes. When talking about health, this risk, I believe, can be even higher. We have different contexts, we have different populations, we have different approaches even from the organizations that are dealing with them. If it's a nonprofit, if it's a hospital, if it's a mobile clinic, all of this, it's so different, and it needs to be taken into account. How to prevent these biases, taking into consideration all of the different contexts that we can see in the health sector?
Absolutely. I mean, it's quite an interesting question because ultimately a lot of what we're seeing when we think of grouping for diagnostics, we can look towards a certain gender or a certain race or a certain area of the world even that are more prone to certain diseases. And looking at healthcare, it's very easy to do that. So ultimately, when you are getting data sets in, the anonymity of your patients is really important. Now, it's an interesting back and forth that I know in Omdana we've talked about a lot, because in scrubbing the data, are you still having the accurate data for the diagnostics? Ultimately, when creating a solution, one way that we work to really fight it, again, is having that larger pool of engineers, making sure we're looking at it from different points of view, different people, to really try and take out that subconscious bias that we're all prone to. And not all of the time is it a bad thing, but it is what we've learned. By building these solutions, you start to see a lot of similarities. How can we take out our previous knowledge to build something that doesn't have bias as that kind of underlying type of I guess really that point of view put into it in order to still get accurate results, but not skew them before we even have them. So it's an ongoing conversation. These are the considerations that Dana has had. You know, some projects that we've worked on is even looking at different ultrasounds to look at the diagnostics for different cancers and how we can diagnose earlier. But ultimately, getting that type of information, you are looking at what you would be looking for bias wise, again, going back to the gender, the age, the race. I don't think that this is ever going to replace what a practitioner can do. And ultimately, I think a lot of bias can be taken out from making sure that AI doesn't replace anything we currently have, but AI is supporting and enhancing. And then as we evolve, we can find a way to really take the bias out completely. But of course, that is something that we're learning to do. That is something that we are very conscious of. And especially in healthcare, as Bruno had mentioned before, with all of the different regulations and laws, it's something that we cannot make less important than the solution we're putting together. They have to both be equally as important to see success.
Great. Thank you so much, Maria. James?
Can you just repeat the exact question again? I'm just trying to work out how I would answer that.
Yes, absolutely.
Yeah.
We were talking about the bias in this algorithm and how to try to reduce them. But actually, I think this is the opportunity to ask you a specific question. Do you think there is a space for nonprofits to collect data better so this algorithm are not going to be that biased?
Yeah, that's. I was going to say I was struggling to know how I'd answer that one. No, that's perfect. Exactly. I think the key thing that I think nonprofits can be doing before they even start talking to tech companies is think about their data, because AI needs structured, organized data in order to find patterns and make predictions from that data. Without that organized data set, it won't be able to do anything. It will do things like do hallucinations, do inaccurate predictions, and that data by and large is very specialized. It is things that actually individual nonprofits or individual people working in context will have. So spending some time to really understand your data, make it more organized, is probably the most crucial step, I'd say, at the very beginning of the process. And certainly that's the first thing that we did at Save the Children. The very first step we did was, right, what data do we have? Where are they stored? Can we get it into a more central location that's organized in a more effective way? Real ask questions about how we're collecting the data. Is it accurate? These are all the questions we asked before we even started talking about AI analysis with that data.
Great. Thank you. Bruno, I have just question for you in this regard. Is trust law available as well for organizations to go and have a consultancy around how to get this data in a better way?
You won't be able to seek assistance kind of directly from trust law for this kind of assistance. So kind of, our model is kind of based around kind of us connecting you to the kind of help that you eventually need. So what we do typically when we kind of work with NGOs is to kind of have a chat with them to understand what their legal needs are. Sometimes we might kind of advise them on how best those legal needs might be articulated in order for that to be kind of turned into a set of instructions for the legal community that we work with. So it's not us directly providing the assistance, but depending on the kind of assistance you're looking for, so long as it's of a legal nature and something that lawyers and law firms are going to be able to help with, that is something that we can connect with. I just wanted to kind of like jump on a couple of things that James and Maria said, if you don't mind. And I just kind of wanted to highlight that a lot of the kind of concerns that they're talking about are, also legal risks and legal issues as well. So kind of the issue around, bias and non-discrimination, it's right that non-governmental organizations are thinking about the legal risks of not taking adequate precautions against that. And a lot of the kind of precautions that James was talking about is exactly what we were talking about earlier, having an impact assessment, kind of really understanding where the data comes from and what kind of mitigation strategies you can adopt in order to address those concerns. And it's not only a data protection matter, with the EU AI Act that James also mentioned a while ago, given that in a lot of situations, healthcare related uses of AI, particularly when it determines access to healthcare, are going to be regarded as high risk. There will be regulatory kind of requirements, especially if the system is going to be used in the EU, for not just the developers themselves, but also the deployers, the users of those systems. There'll be requirements for them to keep on monitoring, to provide that kind of transparency in order to comply with EU laws. So there are kind of, I know that it sounds scary, but there are a number of kind of layers of legal kind of compliance matters to take into consideration here. Yeah.
Oh, thank you so much. I think you mentioned something important, and it's how to avoid discrimination, because like at the end, these biases, they don't have, they do have real consequences, right? And in this case, this is also leading me to my next question, and it's about how these different contexts can disencourage sometimes organizations to apply to get AI support, right? So we have, for example, some countries where the infrastructure is not that reliable in terms of internet connection, for example, or where their population has been largely discriminated because of other reasons. So which kind of advice can you give to them to not be disencouraged by this lack of infrastructure, by this context, and start using AI, or just like try to turn it around on their favor? James, maybe.
Yes, super important question and point. I mean, I think the recent estimates is there's still 1/3 of the world's population who aren't connected to the internet, and then there's even more who may have internet infrequently, might not have fast internet, might not have mobile signals in important situations. So it is really, really important to be aware of. I think that sometimes people often jump to the sort of the direct use of AI, so that the beneficiary is the one that's directly using the AI. But I think it's particularly in the next 5 to 10 years, the majority of the cases, it's going to be indirect, that it's going to be people pre-contact using it in the back office processes. It might be quite mundane things, actually, just speeding up your administration, speeding up the way your organization works from a bureaucratic point of view, so that then you can then have more time to work directly with beneficiaries when you get in that situation. And also AI is a fantastic tool for co-designing, as I mentioned. So there's a huge amount you can use in advance of needing to go into an offline area, producing offline resources prior to that time. So that's what I would say. However, it's something we need to be all really super aware of, because we're accelerating so quickly with AI. You know, that 2 years ago we were not having these conversations. So we're going to be accelerating in the world that has the internet. We're going to be accelerating, and countries that aren't accessing it regularly will not accelerate. So the gap's going to be even bigger. So we need to make an extra effort to make sure we narrow that gap in any way we can.
Maria?
Yes, absolutely agree with everything James said. What I will add is, as a company looking to work with an AI partner, it's important to know that the AI company is global. and someone who has thought through these types of questions and these types of considerations previously, with AI being so new to the table for conversations for a lot of different companies, working with a partner like Omdana that's been around for 5+ years, has a global presence. These are questions that your company, I encourage you to answer internally. What type of partner can you afford who can help you think through your own considerations?
This is bringing me back to something that we discussed before, and you mentioned it, Maria, and now you also a little bit, and it's how not to replace the practitioner, the doctor with the AI, but also how to not disencourage the user to use AI. Sometimes we've seen, and this might seem like a dull example, but you're ordering something through Uber Eats, and then it never arrives, and you want to complain, you want to talk to a human, and you cannot. It's a chatbot, it's AI, and then you're disencouraged to use this technology, and maybe to use Uber Eats for the rest of your life. How to avoid this happening from patients, like reaching out to get health support, but not be disencouraged by the AI use.
Mm-hmm. I absolutely think it's a partnership, and building off of your example, when that happens on an application like Uber Eats, people get frustrated. But now imagine it happening where your diagnosis for cancer is incorrect. I mean, healthcare companies have to keep empathy alive in applications that they are building out. So I think there is a balancing act. I think it's a matter of being an innovative company without sacrificing the experience and also the trust that you have with your current customer base. Healthcare is very unique in the sense that everything is so directly patient centered. And by being aware of that and being conscious of it, you have to, we spoke about this at the very beginning, have it be patient driven, have it be human driven. And ultimately, by keeping that in mind, again, we're all doing everything we can, but it's such a difference in healthcare. The difference between getting a meal and, having cancer is really heavy. And I think that consideration can't be downplayed at all.
Absolutely. Bruno, James, do you have any ideas or tips for nonprofits to keep all of this in mind, and how to work on this human-centered approach, how to work with their beneficiaries when trying to create these tools? Are there focus groups enough, or should they have like more innovative ways to kind of discuss these topics?
Yeah, just very quickly, completely agree with what Maria just said, and just sort of building on that, I think focus groups are super important. I think co-designing with the users is important, but I think the questions you might need to ask might be slightly different from normal. Like, I think in your context, it's really important to understand what it is that the user expects. It might be worth asking, for example, how would you feel if your doctor used AI in order to do this diagnosis? Would that make you feel that you can trust the diagnosis, or would it not? Because I think in different contexts and also different medical conditions, that might be very different. I suspect something that's potentially terminal is something that they don't want AI to be used for necessarily, whereas something that's more chronic is something they would be very happy to. So I think asking these questions very precisely in your context or your culture is really important.
Yes. It's like basically sometimes having also a common sense in some ways, right? Bruno, do you want to add something to the conversation?
I was going to say something slightly more tangential, but I think it's a kind of a broader point, and kind of it also has kind of legal implications as well, which is, we shouldn't confuse innovation with opportunism, right? So, of course, we want the civic space to be exploring opportunities to use AI in ways that they can enhance their impact on whichever issue that they're working on. But we also have to accept that kind of just because the technology is there doesn't mean that you should use it. There will be we should actually encourage society to be using a proportionate type of approach, and this has implications for the data protection kind of issues that we were talking about earlier. Obviously a lot of these tools kind of process huge amounts of data, and it's a very legitimate question to be asking from a regulatory perspective, like, do you actually need to do all of this? So whilst we want to encourage innovation, we want to make sure that that's kind of innovation and not opportunism. Just because the technology is there, you just kind of like find any old excuse to use it.
Bruno, thank you so much. This is as super important point for us and also interesting. We're also thinking inside Tech to the Rescue how to avoid creating tools that then are gonna be that are gonna end up in the graveyard of thousands of tech solutions that were never implemented. And it's really tricky in this case because these organizations want to be more effective. They want to get these tools, and we can offer them. But I want to ask the last question to you: which kind of questions should should the NGOs be asking themselves before wanting to get one of these tools? What they should be looking into before saying or jumping into the trend, oh, I want this AI. What should be the first considerations before jumping into something like this?
Is that a question for me?
Yes, all of you. You can start because you put the topic.
I mean, I think I can only kind of come in from a kind of regulatory and kind of legal perspective, and I think to go back to what I said before, is to kind of ask that kind of critical question about is there a purpose here, and kind of are my plans going to be kind of proportionate to what kind of objectives I have? Can I foresee ways in which I can kind of address and mitigate some of the risks, or are the risks too great for me to be kind of going down that line? But my kind of message to a lot of NGOs who might be kind of looking for opportunities to use AI is that a lot of these questions can be quite daunting, but help is available in various different ways, whether it's legal, whether it's technical. So kind of there are ways in which you can, kind of make a more informed decision about these kinds of questions.
Maria, maybe you want to jump in?
Yes, some questions that I think would be really beneficial for NGOs to ask when looking at an AI partner have to do with just that. Are you going to have a partner in the development? What that looks like for a company like Omdana is, are we going to be with you not only through creation, but also the implementation? How are we going to help you evolve? And how are we going to make sure that if you bring on new people to your NGO, how are they going to be trained? How is the solution going to grow with you? That's why we're not only focused on a customized solution, we're focused on the customized impact. Long term, what does that look like? So ultimately asking not only what AI do you think we could use as a company, how are you going to help us see it all the way through? We don't want to, just go into another graveyard. That happens so many times. And a lot of times there are fantastic solutions. It just was never truly implemented and never really ingrained into what the NGO is trying to accomplish. So making sure you have an actual partner and asking questions around how that company plans to be that for you will really set apart a successful long-term solution versus just another product that, 5-6 months down the road is no longer applicable.
Perfect. James, to close and before going to the Q&A.
So yeah, just building on Maria, I definitely, I mean, it's a bit of a myth that tech companies are just interested in making the tech and then they hand it over. Tech companies are interested in it being used and having impact. That's what they want. They want to be there for the whole journey. So I think for nonprofits, before they start engaging with tech companies, I would say work backwards. Start with what is your ideal at the very end, and work backwards through every single step before you get to the tech, because then when you do speak to tech companies, you can tell them the journey you want it to go on. It might not be the final journey you take, but that will help you then in that conversation with them, and then they'll understand that you want to go through the whole journey with them as well.
Thank you so much to all of you. It was a really interesting conversation and insightful for me as well. There are some questions from the people joining us, and I want to start with one that is, I believe, for Maria. Maria, how accurate is AI right now diagnosing mental health problems? Can it be trusted?
Yes, I really love this question. A big reason why I love it is because mental health is a very gray area in healthcare. And asking how accurate it is such an interesting approach, because right now there isn't a very black and white diagnostic. So adding in AI, I think, is more about how we can supplement what is currently going on. So for example, diagnosing mental health, a project that Dana's worked on is looking at language when people are using a chatbot to understand how far into a mental health crisis they are and ultimately who they should be connected to. By really using AI as a supplement to what practitioners are doing, it can be trusted. However, it's not to be trusted on its own. I think that with mental health specifically being gray already, we are able to trust how we're going to be able to get more help to more people. But especially in mental health care, there's never going to be a standalone option for something that is on such a spectrum, is such a gray area. But what we can focus on is being a partner to get more help to more people on a larger scale.
Absolutely. James, maybe you want to add to that a little bit. I just had a thought what you were talking, Maria, and is that usually when you're working with health, you have a referral system. So if I'm a patient and I went to a regular practitioner and they found out something wrong, they will refer me to a different specialist. A way to mitigate this can be AI maybe referring to a real specialist, but how to do it, how to plan this referral from a machine to a human being. So James, maybe you want to add.
Yeah, and I mean, if it's possible, I mean, there's another question that came up at the same kind of time about AI hallucinations, and I think there's sort of an overlap between these two as well, because I think one thing I think it's worth just sort of clarifying is that a lot of the AI that we talk about in the media, like the Chat GPTs, the Geminis, these chatbots, they're really designed as general AIs, as in they're not really designed to be specialist in any particular domain. They're just specialized in language and talking. And actually, if you ask them for mental health advice, it's not going to be trustworthy because it's not designed to be. And there are a lot of the tools out there do use these general AI, and they do something called fine tuning or prompt engineering in order to turn them into something that isn't trustworthy into something that's trustworthy. And so the question is not about so much about is the AI application trustworthy, it's more is the person who's then used that to try and then fine tune it, to use prompt engineering to turn it into the tool, is that process has that been transparent? Do we understand all of that? Because that's where the term hallucinations come from. It's the idea that chatbots find it very difficult to say they don't know. They always try and say something. They don't want to say they don't know. You can actually train them to say no. You just tell them, please do not guess, and they don't guess. So that's the way around it. But yeah, that's kind of the answer to my question. So the general purpose AIs are very different from the specialist AIs that will be the ones that are used in the medical context.
Thank you, James. Bruno, I think there's a question that you'd be the more suitable to answer. And is, what security risk do you see in AI implementation if you eventually plan to use AI from big companies like Meta, AWS, Microsoft, OpenAI, etc.?
I'm not sure, actually. It's kind of, this is like a data security type question, and kind of I feel as though I'm not particularly qualified to answer that question. But I think if I can kind of like shift the question a little bit and kind of turn it into something that I am able to answer, I think a lot of the one of the things that you really do need to bear in mind if you're going to be using kind of these kinds of tools from kind of big companies, kind of Chat GPT, for example, is that you also do need to be aware of kind of terms and conditions. So there are, some of the questions that we get from NGOs who kind of contact us for advice is about precisely this issue, about kind of, if I use these kinds of models in a particular way, am I going to be violating the terms and conditions? Are there ways in which I can get around them? And what would be the likely consequences? And kind of adjacent to that, there are also questions around if I use these kinds of tools in order to create something, what will be my intellectual property rights? What is the risk that I might be infringing on other people's intellectual property rights, and so on. So if you're using these kind of third-party tools, there are kind of bunch of other kind of legal issues for you to be thinking about, and that's kind of something on which it's worth seeking some advice on.
Great. Thank you so much. I want to thank you all again for being part of this webinar, for the people joining. I saw a lot of people from African countries, also Giovanni from Colombia, and then James, Maria, Bruno. This was super interesting. I hope the NGOs joining us found value on this. And lastly, just remember that if you want to be part of our health cohort, you can go to our website, techtotherescue.org, and register. Thank you so much again. I do hope to see you again. And again, just thank you and thank you and thank you. We'll be seeing each other soon.